Hello, everybody, and welcome to the community working group webinar on mapping for COVID-19 response and resilience. My name is Sophie Moa, and I'll be hosting today's session. The couple of housekeeping things: if you have any questions, please feel free to pop them into the chat. And just let us know if you have any issues or have any questions for anyone. There will be an opportunity for a Q&A at the end of each of the talks. So if you do want to take yourself off mute and talk at the right opportunity when we invite questions, then please feel free to do so. So this webinar is hosted by the Community Working Group. A big warm welcome for us. And we also want to say a warm welcome to those folks who have recently joined the Community Working Group. So that's Jika, Jason, John, Derek, Hawa and Emma. Thank you for joining, and thank you for all your hard work in the group so far. If you are not a member already of the Community Working Group and you would like to be, you can join us on Slack at community-wg, or you can email community@hotosm.org for more information. So please feel free to do that and join us if you have a bit of time and you want to see what we get up to. So today we are going to introduce HOT's COVID-19 activation group and the activities that have been happening in HOT and beyond. Then we're going to talk a little bit about what the community has achieved. In the third section, we'll move on to our talks from our fabulous guest speakers, Map Uganda, Humanitarian mappers from Nigeria, and Map Kibera based in Kenya. And then at the end of today's session, we are going to try something a bit new and break out into breakout rooms and to have an opportunity for some community networking. So if you have 10 to 30 minutes at the end of today's session and you'd like to get to know some of the community, then please feel free to come and join us in those kind of very informal networking breakout rooms. So let's move on to the first section. So to meet the wide variety of needs and requests, the COVID-19 activation team here at HOT divided into kind of three main activity areas. The first of which was remote mapping. The objective of which was to increase the available data for response partners and partners on the ground. We also had the second kind of key area, which was the disbursements of microgrants to 7 different communities across the world. And we also mobilized our partner and outreach and support, where we assessed humanitarian community partners for their needs and looked for different collaboration opportunities, provided training for response actors and governments where needed. So they were the 3 main areas of response that we focused on. And those responses were active in 33 countries. You can see here where the activities were HOT-led, where the activities were community-led, and where microgrants were, where micrograntees led the response there as well. And we're on standby to support 15 more locations and communities in those locations. So let's talk a little bit about the achievements that we were able to do. First of all, the COVID-19 response was the largest response in terms of contributions. So 15,000 mappers contributed almost 2.9 million map features to #COVID-19 on the tasking manager projects. This included nearly 2.6 million buildings and over 55,000 kilometers of road, as well as loads of additional data around health infrastructure. Big shout out to all you validators out there. The validation kept up with the remote mapping at a whopping 91%, where an average of 96% of the projects have already been mapped. So that's a fantastic achievement, only 5% difference in average. So big well done to everyone who was validating as well as remote mapping. There were up to 24 scenes or locations uploaded from lots of different places, including Maxar's Open Data Program and Open Aerial Map, so that this remote mapping could take place. And lots of corporate organizations were also involved in the mapping to really kind of get momentum around getting locations mapped and really having that impact by not only the community, but also by corporate partners as well. So let's talk a little bit about the microgrant program overall. We are going to be hearing from 3 of the micrograntees in a little bit, but there were a rapid response microgrant awarded to 7 different OSM communities, Liberia, in Liberia, DRC, Senegal, Mongolia, Uganda, Nigeria, and Kenya. And those communities did many different activities. And the numbers that we have here, I just want to flag at this point, only 3 of the communities have submitted their final numbers to us. So this number is still growing. The communities hosted 33 training events, trained 161 individuals. 110 of those individuals were new community members, and 27% of those new community members were women. So really big well done to all of the trainers who were training in this program. And of those 7 communities, the 4 that have handed in their final metrics, there have been over 1.9 million edits made, 4,225 COVID-related points of interest added to the map, 13,000 kilometers of road, and over 340,000 buildings put on the map. So yeah, really impressive stuff. So if anybody has any questions on that, let's start with some questions on the response. And if anyone else wants to speak from the community working group, please feel free to do so. Okay, I can see Saidu has asked, can I be part of the mapping community? Absolutely. Get in touch with us and we'll pop you in touch with the person in your local area to be able to get involved, or you can map remotely with the support of the community working group. Any other questions? Okay, fantastic. So, Samson, are you here?
Yes, I am.
Yes.
Sophie.
Hi, welcome. Okay, great. So I'd like to introduce everyone to Samson from Map Uganda. Samson, do you want to start telling everyone about your project?
Yeah, sure. Thank you, Sophie. Thanks everyone for attending this webinar. My name is Samson Ngumenawe from the Map Uganda, or what you can call OpenStreetMap Uganda community. And I'm here to talk about our experience on how we stood up and did some of the activities during the coronavirus pandemic. So here is a project that we did in order to respond to the spread of the pandemic in Uganda. So about this project, so when this pandemic was announced, it really affected so many communities. And then specifically for Uganda, most of the cases were actually coming from outside Uganda via the porous borders of the country. Those are the border entry towns. And so with the funding from the Humanitarian OpenStreetMap team, Map Uganda teamed up with the Geo Youth Mappers, that's the Youth Mappers chapter at Makerere University, and the entire Map Uganda community to map out those towns and create data and maps that can be used by these responding agencies like the Uganda Red Cross Society and the Ministry of Health to improve their surveillance and relief services. So that's how our project was. The next slide, okay. So for our project, we had a number of objectives. And the first one was to actually have all those porous borders fully mapped on OpenStreet, and also to avail the data to any other person that would actually need the data for any other purpose. Then the other objective was to provide training to community members that are new, and also to enrich the old members with new skills in JOSM, in QGIS, and the new tasking manager. Then also we were meant to support COVID-19 responding agencies with specifically the maps that would be generated from this project. Next slide. So our project had a number of activities, and these are the ones that you're seeing on your screens. One, we needed to engage the local data user, that was the Uganda Red Cross Society, on how we can support them through their relief services. And then the other activity was onboarding Map Uganda on the tasking manager. Before, Map Uganda was not one of the organizations that could run projects on the tasking manager, but through this project, Map Uganda was onboarded onto the tasking manager, and we had a training by Mr. Geoffrey Katerega, and now we can create, manage, and monitor our own projects on the tasking manager. Then also we had trainings for the community members. We also engaged members from the local data user, that's the Uganda Red Cross. We had to train them in JOSM, QGIS, on how they can make their own maps and how they can contribute to OpenStreetMap using the HOT tasking manager, and also on how they can monitor the data quality of OpenStreetMap data using these data quality tools like OSM-CHA. Then also, leave alone those other activities, the main activity was actually mapping and validating the 27 towns which were mapped under the 25 projects that were created on the tasking manager. Then with the data created, we had to design maps that we are disseminating to these responding agencies to use in their services while responding to COVID-19. Next slide. Okay, what have we achieved in this project? Like I had said before, through this project where Map Uganda was onboarded onto the tasking manager, so now Map Uganda teams can actually create their own projects. For example, currently, Map Uganda is mapping the newly created cities in Uganda, and we are creating our own projects. We already have some projects running, like where we are mapping Mbarara City on the tasking manager. Then also in the same project, we were able to train over 30 individuals from the entire OpenStreetMap community. Some were our old individuals that we have been mapping with, and others were new. So we also have created a kind of strong relationship with the Uganda Red Cross Society and the Ministry of Health, because right now, whenever they need maps or data, they can easily reach to us and ask us whether to create for them projects or to create for them maps or to download for them data, whatever they would want. And with ease, we can provide that information to them because we have created that kind of relationship. Then we have mapped those towns and we have designed maps. Right now we are engaging these map users on how we can enrich those maps. What more, apart from buildings and roads and waterways, we are engaging them to see what more other features we can add on the map so that we can enrich those maps to accommodate so many users. Next slide. Okay, as you can see on that screen, that's a screenshot of the tasking manager showing the Map Uganda projects that we created. But you see that one, that is the logo for Map Uganda, and those are some of the projects. In total, we created 25 projects that we are fully mapped and validated. So what you're seeing there, those are 14, but there are more. This is just a screenshot of the tasking manager. The next slide. Okay, what you're seeing there, we were carrying out training. I also want to let you know that all this was done remotely because we were under the lockdown when we were running this project, and it was completely remote. So everything was done online. So that's a virtual training on the tasking manager. And by then we had around 14 participants on board. Next slide. Those are some of the photos of the activities. However much we were running the project during the lockdown, but later the lockdown was eased and we had an opportunity to meet with some of the mappers. So like what you see on the right-hand side, that was the coordination team. Stella, Maris, and Fawaz, we were designing the first maps. I think that was the first draft of the maps that we designed on that day. And then on the left-hand side, we were also able to bring in some few members from the mapping community, and we held a mapathon. I think that was on the birthday of HOT. Yeah, that's when we held our mapathon. So those are some of the pictures that we had to capture when we met physically. Next slide. Statistically, those are the achievements that we made through our project. We were able to train over 30 individuals from our own community and from the local data users. And out of those, 16 were males and 14 were females. And then we were able to map the total number of 25 projects on the tasking manager. And throughout, we mapped a total of 250,000 buildings, and we mapped about 7,000 kilometers of roads and about 400 kilometers of waterways, because our project was mainly mapping buildings, roads, and waterways. Next slide. Like any other project, also we didn't fail to face challenges. Some of the challenges were there. The first one is because the project was generally executed under the lockdown. So I believe some of the people were not able to participate in this project because they couldn't have access to the internet, access to the computers, because you may find, for example, if the universities were open, some of the students could have access to computers in their computer lab, and the number of participants would have increased. But now that we were under the lockdown, some were in their villages where there's no access to internet, so it was really limited in such a way. Next slide. But then with all of those things, the challenges, whatever we faced, whatever we did, the communities that we trained, we want to give a lot of thanks to our supporters. That's the Humanitarian OpenStreetMap team. We actually, it may not be only the HOT family, but everyone, maybe volunteers, whoever participated in our project. Because when we created our first project, that was Elegu border town, we had a lot of volunteers coming in through the tasking manager, because Sophie had asked us if we could share our projects with others so that they can come in and help. So we want to thank whoever participated on mapping with us during our project. And we also want to encourage other OpenStreetMap communities to take part in these microgrant opportunities so that they can map our world and make a difference. Thank you so much.
Thank you so much, Samson. Fantastic work, and yeah, really, really wonderful. So great job. Does anyone have any questions for Samson and Stella Maris?
Hello, Sophie Kehinde.
Hi.
The only question I have is, how do we clap for the speaker when the presentation is over? Thank you, Sophie.
Great. Anyone else? I saw there might be a message in the chat from Adrian. Adrian has asked, I know that some countries in Africa are implementing GDPR-inspired data protection regulations. Has it had any effect on the humanitarian sector there? Fantastic question, Adrian. I'm wondering if it can be saved for the breakout rooms at the end of the session. I'm going to take that as a yes. Okay, great. So moving on, I'd like to introduce Kehinde and Kazim from Humanitarian Mappers. Take it away, Kazim.
Yes, afternoon, everyone, morning and evening. Guessing we're in different timeline. Yes, so our presentation, basically, I'll be co-presenting with Kenny. So we'll be starting with what our project was basically about. It's basically about using OpenStreetMap to support ambulance response service and also COVID-19 response during the pandemic. Major outline for this presentation, we'll be discussing the issues and objectives, the strategy we adopted, the stakeholders, and how we're able to partner with government. We'll be looking at the impacts and the outcome, sustainability, and we'll be looking at the challenges and lessons we learned going forward. Next, please. Yes, basically, what we've observed is the issue. We do know that in the northeast Nigeria is being ravaged by insurgency. It has for the last couple of years, more than 5 years now. And because of that, with COVID, it becomes more should I say, it becomes more, the emergency scale increase, the phases increase. That means more people are now there are more issues because of COVID, a lot of things are now happening. So we need to now look at how can we support this region, this particular part of the country that is already bewildered with insecurity. So one of the things we thought, one of our objectives there was, how can we help to identify and map infrastructure that can help government to respond to COVID? How can we support our mapping solution, especially for the ambulance driver that pick people from the isolation centers or from their homes to the isolation centers, to the treatment centers? Then how can we also train members of the local community to continue mapping, because we have people in the Northeast, and we all know that most of these people, especially the youths, were at home during that period. How can we train them? How can we establish like a youth mappers club there? Because there's none in that part of the country. How can we establish youth mapper club so that they can continue to map this thing when we even finish? Then also sustainability at the long run. Next, please. Yes. So for the strategy, I'll just go about the strategy we use. The first thing we did then was to engage with the government. We met the clients and we engaged with the government. Our client here is the government, or we can say our client here is HOT. So we met with HOT. HOT is their funders as well as our clients. We have one or two talks. This is what we want to do. I'm very sure of us did that. What our proposals, we discussed. They gave us the nod. The funds came in. Then we proceed to meet the stakeholders. The stakeholders in this, in order for the project to be successful, we knew that we have to work with a partner on ground, which is Alubarika, and also the government. So because Alubarika have that present already, they've been working with these people, and also they know the government people. So we brought in Alubarika, which is an NGO non-government organization already on ground, and we also met with the government, and we discussed what we want to do, our objective, how we are going to do it, the approach we are going to use. We all come to terms and conditions, we agree timelines and other stuff like that. Then we moved forward to the next review. This is where we discuss about how we're going to plan, what are our work plans, our tools, how we're going to do how we're going to get volunteers, because as I've said before, there was no volunteers here. We have to get new volunteers. There are some old people that have been working with us. We have to also get new people. And because we're also trying to establish a youth mappers club, so we design our strategy. So the first thing we did after we've done our desk review and coordination, we've done our work-up plan, we move on to data collection and OSF training. So out of the people we trained, we assigned 5 people. We got 5 people that were trained using Coco Collect to collect data and to map. So and also do the OSM training. This is where we brought the community mappers together. We train them, and don't forget, because we are mapping from home, there are some certain criteria we also have to look out for. People have to have laptop, people have to have access to power, people have to have access to internet. You have to have your phone should be a smartphone that you can use to buy, or you have a modem that you can, so because people are working from home during this period, we have to buy airtime, we have to ensure they have laptop, we have to provide them with access, whether they have a gen, when there's no power, they can put that generator set on. So we did that. Then we also move on to our mapping itself, real-time data collection. When data collection was going, we have to do what we call data quality assurance. We are ensuring that they are collecting the right data. And from there, we have the database management. It's just, let me just put like an Excel sheet, but it's more than Excel. But for purpose of this, let me just say, like, where we put all the data that has been collected, we clean it, because we're also going to make map. We have to look for administrative data of this region. Each administrative 1, administrative 2, administrative 3, we have to start digitizing the roads and stuff like that. Then we did data validation and data management. Then we go back to our stakeholders again. After we've done our mapping, we went to debrief them. I said, okay, this stakeholder, at this point, this is what we've achieved, so that they know. So we are carrying them along and they know what we've done. So these are the next step. This is what we're going to do. From there, we did a bit of analysis to get insight from the data, how many roads do I map, you know, how many points of interest was collected, how many COVID-19 structure was collected, and you know, so that we can inform them. We went to mapping. The mapping is where we produce our final products, and also we can say from there, from the mapping again, we did a verification and feedback to the stakeholders again to ensure that, okay, this is what we've been doing. Then we check our delivery checkout lists. From the checkout, we are ensuring that from what we told our clients we are going to do, have we been able to achieve it? Have we achieved it 100%? What is left? What have we not done? Then we also do debriefing. The last one we did our debriefing, retrospect, and stakeholders engagement. At this stakeholders engagement, don't forget, this is where we now did training for our drivers, for the ambulance drivers, because we also train them on usage of OSMR. Like the data we've been able to, the roads, the buildings, the health facilities, the COVID-19 infrastructure, such as isolation centers. That is where we now train them on how they can navigate from point A to point B and use from other things. Then we have the closeout and project documentation, which I'm very sure all of us have done and we are still going through. And I'm very sure it will come to an end when we finish everything. So that is the strategy we adopted for implementation of this project. Next, please. If I'm too fast, please let me know. So I will also like Kenny to take up from here. These are the stakeholders. Kenny will take up from here. Thank you.
Yeah, thank you, Kasim, and thank you everyone for taking time and listening. So like Kasim rightly said, the stakeholders that we engage, we have different levels of stakeholders. We have our donors, we have our implementation partners, and we have the government, the regulatory bodies. The government in the state here, there's a need for you to get approval of the government before you roll out any interventions. Most especially with respect to the humanitarian response and the COVID. We have a ministry here that we work with directly, which is the Ministry of Health, and under which we were able to work closely with the Director of Public Health, who also introduced us to the COVID Task Force team at the State Emergency Operations Center in the state. So these are the people that we collaborated with, and from the time to time, they were at a point invited to one of the engagement with our volunteer during the training sections, and they came as an observer to see what we were really doing. So the government was very, very much involved in every state of the project that we were doing. So next slide, please. So with respect to the partnership that I just made mention about, the COVID task force is actually the task force that has the responsibilities of coordinating and implementing the COVID response that the government have rolled out in line with the federal government and WHO directive in the states. The mandate for this team is very big. For the one that we focus on is the kind of support that we try to provide for the hub ambulances with respect to the COVID infrastructure and all the various pillars within this team, and how it affects the way the data that we collected, most especially the point of entries, the ambulance drivers that we have identified, and the training that we provided, and the level of engagement that we were giving to them, and the sustainability plans that we also share with the government. So the COVID task force was the one that eventually was implementing on behalf of the government, the host government. So with respect to Albarca being our local partners, our local NGOs, they've been in the States for quite some time, and they've had a number of experience working with the government and with the internally displaced persons. So they were very much helping us with the administrative facilitation and coordination with the governments. We met the various people, the commissioners, all of them through their help. Next slide, please. So like the engagement that I've actually explained earlier, our engagement with the governments at various levels, with the Barca, our local partners who assisted us, and enormous of our engagement with the volunteers, the young, the mappers, all of them that come from various universities, young people who sacrifice a lot of their time, their resources, because we cannot say we pay them for the efforts that they put, even though we try to, that way we can mitigate their expenses, but we were so overwhelmed by the enthusiasm and commitment that these volunteers have given to us. And more importantly, is the after event, the after event, the sustainability plan, the way we want to carry on with the MAPA communities to begin to continue to support the data that the ambulances will continue to use even after this project is over. Next, please. Okay, so like we have indicated earlier, we have a number of outcomes and the impact of them. The indicators that we try to look at is the number of data that we have captured, as shown in this narrative that is here, the number of editings that we have made to contribute to the OSM data repositories. I won't go through this one by one. Let's go to the next slide, please. So in terms of what we did, about 30 mappers, we've provided the adequate training to 30 mappers. These are people that we continue to support the project even when it is closed out, and also provide a data support to the ambulance driver for them to update from time to time. Initially, we have a field officers that we recruited, about 5 of them, who provided a data collection for most of the COVID infrastructure. We also try to start a youth mapper clubs in Maiduguri. We have targeted the undergraduate students in the university. Most of them participated in the volunteer mapping jobs that we did. And the last category of people that we impacted on are the driver, the ambulances driver. We actually did our pilot for 5 ambulances. That's the pilot that we had, but we had additional 2 drivers as a backup drivers who might also be need to be trained as a backup for some of these drivers. So we have tried to impact them with additional technicalities. And is there any question?
Kehinde, would you like to continue?
Yes. Okay, so sorry about the interruption, whatever name it is called. Please, sorry about that. So like I was talking about the last level of the impact that we provided, the ambulances driver, we have about 5 ambulances, but we had about 2 more extra drivers to train just in case one of the drivers is not available at the time, so that the backup driver will be equipped to be able to use the tool in the absence of that. So next slide, please. So like we explained about our sustainability plans, our focus on this plan, the director of public health, like one of the senior principal officers in the government, in the Ministry of Health, is actually a custodian of this project. The COVID task force actually report to him and so many other officials. So he's so much taking the ownership of this project, and we are trying to establish a direct link between these government people and the youth mapper clubs that we've set up, that we are trying to strengthen, to continue to provide and updated data to the OSM repository, which will be available from time to time as an update for the ambulances driver. So what I'm saying in essence is this. So this kind of linkage, we are likely going to have a lot of work to do at our level to ensure that we provide sufficient support we continue this support even when this project is over, to ensure that our mapper are strengthened such that we'll be able to provide this kind of data that change from time to time to the repository. Next page, please. Okay, so as part of the challenges, apparently, the task, there were limitations on the area that can be mapped, which can be more than 5,000 square kilometers. So there are the data import challenges, which I think.
Let me just, when you finish, I can speak 1 or 2 more on this.
Okay, all right, Kasim. So maybe you should do this, then I'll wrap it up.
Okay.
Kasim, go on.
So for the challenges, basically, I think on HOT, and one of the major challenges we found out on the HOT taxi manager is, and I understand why is that, but I'm still thinking if there should be, you can't map beyond, you can't create an area of interest or a mapping area more than 5,000 kilometers. But in an area whereby you are doing some projects that have to do with just data imports, or you are mapping specific points, I think there should be an option for that. There should be a customization that allows for that, for those exceptional cases. Because, for instance, Nigeria is a very big country. The 5,000 kilometers is quite very small. For if you are digitizing roads and building, it may be lovely. But if you are mapping just points that you've collected some points, or you want to import points, and it's being restricted to 5,000 kilometers, I think it's small. Because that's one of the challenges we had when we want to import our air facilities, because imagine you creating about, like the way Uganda mappers did now, they created about 25 tax manager projects, which if you are going to create for a place as big as Borno, which is very, very big, and don't mind, we did 3 states. Imagine how many you create and what you take it, the time to take it to map them, or to validate, or to create them, the energy and stuff like that. So I think it's something I'm proposing to the OSM, probably working group, to look at it and look to create option. I know it's good to manage, but it can be a customization that it allows. When you provide those needs, you provide those justification, it can allow you to create it. Another challenging is, for government, when you're working with government, you have to be always having this continuous engagement. That means you have a way, because, well, especially not just governments, any stakeholder you are working with, they have to be that continuous flow, which is very challenging, especially for data. You have to continue to engage them, you have to keep them abreast. Then also, there always changes a lot in government, even stakeholders, they change the officers, they are not around, so it affects a lot of stuff. The other challenges and lessons we've learned about is always good. We tried the media stuff came in very, very late. I think even HOT tried to educate us on that, but it came in quite late. So we were able to banter with the media at the very large as we would love to. By the time we're able to get that thinking, it's already late. So it's always good. I think that was something we learned, that always ensure that from the beginning of the project, bring in the media, there's a probability that they will do it at a very cheap fee, or they won't even collect any money at all. So those are the challenges and probably lessons learned. And also, I think that some part of the slide is not here, but successfully we've been able to, I don't know if I can share my screen, but we've been able to, we've installed, I don't know if I can share my screen if it's possible, but we've installed.
We're running a little bit short of time.
Okay. So
we have
yeah, no problem.
So would it be okay
yeah.
to wrap it up, and we'll move on, and then you can share your screen in the breakout sessions. Is that
okay? So just to wrap it up, we've done installation for 5 ambulances. We've installed the tab, and also we've done maps for facilities too. So thank you very much. We appreciate the efforts and the opportunity given us by HOT to contribute our own little quota to the development of the Northeast overall in Nigeria. And we are hopeful that this will give everybody that it's possible. And thank you very much.
Thank you so much, Kazim and Kahinde. That was really informative, and thank you. We're going to move on, and if anyone has any questions for the Humanitarian Mappers team, please feel free to get in touch with them directly, or you can speak to them in the breakout rooms later. Do we have Zach on the call? Zach, are you here, and are you happy to start presenting about your work with Map Kibera? Zach, if you're speaking, you are on mute. Zach, can you hear us? Okay, looks like we've got a few technical things happening there. Is there anyone else on the call from Map Kibera?
Hi, sorry, I was getting a notification that I can't unmute, so yeah,
Great.
sorry about that. Yeah, so hi everyone, my name is Zach. I work with Map Kibera as the lead mapper, and I'll briefly present about the work that we've been doing here in Kenya, and specifically in Kibera, in relation to how we are using mapping and crowdsourced information to respond to the COVID pandemic, specifically in Kibera and other informal settlements of Nairobi. Next, please. So on 13th of March, Kenya reported its first case of COVID-19. And what followed was, there was a lot of fear that had engulfed the country. So it's like the whole country went into a panic mode, and everyone was afraid what will happen to the country going forward. And considering the situation that has been projected from other countries, and how the disease had put like the life of many people on a standstill. And Kibera was not spared in this case. I remember when the case was first reported, we were still in the office, and you could see when you went outside, you could just see it in people's face. There was a lot of fear, and you could see people discussing groups, and sort of there was a lot of uncertainty. And this also because of a lot of projections that were being or that were coming in about how Kibera could be one of the worst affected areas because of how the nature of the settlements, how people live close to each other. There were a lot of documents and articles and media coverages that were done about Kibera in the following weeks. And most of them were showing how issues to do with social distancing was next to impossible in places like Kibera, considering that the bare minimum in a household, the least number of household members in places like Kibera is around 7 people. So issues of social distancing would be a challenge. Then there were other factors to do with access to clean water. Most people in Kibera do not have like running water in their houses. And if they have to access water, they have to get it from outside. So there are a lot of factors that were coming in, just trying to project how Kibera will be affected, widely affected by the disease. So this also led into the fear that that people had in the community, and also the directives that were coming in from the government, and people were worried how they won't be able to run their business as normal. And there was a fear of losing their jobs and their business being affected, because most of them also rely on, most of them work as casual laborers. So that means if things come to a lockdown, that means most of them won't be able to work. Next slide, please. So these are just some of the myths that were going around. around that time. So I think most of us also came across them. So there was things to do with how COVID-19 can survive in warm weather, and so there's this misconception that if it happens, then maybe people in sub-Saharan countries won't be affected so much. There was also misinformation and myths about how Africans can be affected by this, and children also don't get really affected by COVID-19. And this all this misinformation was mainly was coming from a place where people are lacking, there was lack of adequate information, and people didn't know where to get like the right information. So because that lack of information, this is what was breeding all these kind of myths and misinformation. And what we were observing, there was some sort of negligence from the community, because when you get to see all this, then people were not taking the disease seriously in the beginning. So despite of the fear, when all this misinformation is coming in, people are tending to become a bit reluctant following some of the directives that are coming from the government. So next slide, please. So due to all this misinformation that we were seeing coming in and going around, especially in places like Kibera, and what you also notice, the setup of the communities, most of these things, when they come in, they tend to spread very fast. It's because people live like in a community, so most of these rumors will spread very fast, and sometimes we'll come across them. So that's why we now, in partnership with Ushahidi, we decided to deploy an Ushahidi instance, which will enable us to be able to track the cases and basically to see the progress, especially in terms of the cases that are being reported in places like Kibera. We just wanted to see what are the progress, and if things get worse, then trying to find what are some of the means that we could, or some of the provisions that we could provide, or get the community to access some of the services from either the government or other well-wishers, so that they can be able to curb the spread of the disease. So apart from just providing information, we are also trying to map out resources. So after the disease, in around April, a lot of organizations started putting up initiatives in the community to support the community. So as I had mentioned, in places like where the issue of access to clean water, so some organizations were putting up hand wash points in strategic locations where people could be able to access free clean water. And so, and most of these were put in places where there's a lot of traffic, so people could be able to at least access these facilities. Then there was a lot of community awareness that was being done to just educate the community about the disease, and just reminding them why they need to follow up some of the directives that are being provided by the government. And if they adhere to this, then this will enable the community at least to curb the spread of the disease. Also the platform was, the aim was also to, apart from the resources, so we also trying to engage other stakeholders and other organizations to also put up some of the activities that they are running, so that people can be able to see. For example, if there's a food drive, we'll locate exactly where the food drive is being done. So then the organization will share like their number. Then we'll communicate with the community. So if you need any support in terms of food or any other services, then we'll just direct them to the platform, and from the platform they will be able to get the contacts, and they'll be able to reach out to the organization. They'll be able to get whatever help they needed. And also we launched, we created a WhatsApp group that we having like community members to register. And through the WhatsApp group, we're also broadcasting all the information that we are getting from the platform and other sources, and just sharing them with the community. So this was just to keep them up to date with the events and the information that is coming in, especially from the Ministry of Health, the information to do with just basically like at one point the Ministry of Health was trying so much to pass information to just let people know that some of the myths that are going around are not true, and why they need to still stick to the directives that are being provided by the government, and not fall into fear and panic. So the WhatsApp group was basically just to broadcast all this information that you are getting from the other sources, and passing into the community. And we had like continuous engagement. So sometimes we'll get questions like sometimes they will ask like what are the number of cases that have been reported in Kibera in that day, and if we got the numbers, we'll share with them, so that they're able to know how things are progressing in the community. Next slide, please. So around May, we applied for the Rapid Response Microgrant. We got selected, and the grant really helped us to support the work that we were doing. So we were able to continue to post the cases that were coming in from the Ministry of Health on a daily basis, and also trying to track like other resources that are being provided in the community and other parts of Nairobi. We also expanded to covering like the entire country, just trying to see what are other services that are being provided to other communities around the country, and also continue to post the daily cases countrywide. The grant also helped us to expand to other informal settlements. So as I mentioned, we had started with Kibera. The main focus was Kibera, but we also realized the same challenges that the people of Kibera were going through are the same challenges that other communities are facing. So we expanded to 2 other formal settlements, that is Mukuru and Madare. Mukuru didn't pick very well, so we stuck with Madare. So we worked with some of the community members from there, and also some of the team members that we have from Madare. So basically just trying to track the activities that are being conducted in the community, getting to see what are the services that are being provided within the community, and the stories that were coming in from those areas. And one thing that we realized, they were all the same. So in terms of resources, that's basically well-wishers and organizations that were providing food, they were doing food distribution to community members, because at that moment, most people had already like been affected majorly by the lockdowns the government had put in place. So most people are not going to work, businesses had been closed. So most of them are like relying so much on well-wishers and getting like any kind of support from anyone. Then through the microgrant, we were also able to do conduct some remote mapping trainings where we focus so much on the health facilities. We wanted to just train community members within Kibera, and just showing them how they can be able to contribute and update the information that was there, because we had already done some mapping. So just basically like any new update that is there in terms of new services that are being provided by those health facilities, and just showing them how they can be able to do that remotely without having to go to the field. So we used health sites in this case, where we were using it to update some of the information about health facilities in Kibera. And also, lastly, we also partnered with Ushahidi, where we trained some organizations and community members within Kibera and also Madare. And now they can be able to make use of the data that was coming in on the platform. Just so the idea also of the platform was just basically to show the distribution of resources and to avoid duplication of these activities. In what we noticed is whenever there were any kinds of support, it's like all the organizations are focusing on one area, and you'll find like there are a lot of areas, other parts of Kibera and other parts of Madare that were being left out. So the idea of the platform was also to just show the organization, like what are some of the activities being carried out by different organizations, by the government and other well-wishers, and just for them to have like an idea of what is there already, and then they can figure out how to either supplement what was already existing or come up with something different that could be beneficial to the community. So we were training them now how to, once they have interacted with the data and they have like other activities that they have carried out, then how to post on the platform so that other community members and other organizations can be able to see the work that they are doing. Next slide, please.
Fantastic. Zach, just to let you know, we're running
So
so
through the project, yeah, so these are some of the success stories that come out from the project. So we've seen more organizations using the data, getting to see, basically interacting with it and seeing. We've seen more hand wash points coming in, and we've seen like equal distribution of resources. So it's not just focused on one area. We've seen organizations moving to other areas and providing resources and services to those places. Also, through the trainings, the organization have also taken up the initiative to post their work. So we've just been following up and just finding out if there are any new activity that they are doing, and just that willingness of the organization to be able to post their work, and you could see the excitement and the ownership when through the training and the commitment we are making to that they will be able to be posting the work that they are doing, and some are even willing to backdate some of the work that they have done in the previous months. So also for the trainings, we were able to train new mappers. Apart from the ones that we had like quite a number of new mappers that we trained them on how to contribute to OSM. We did some training on basic editing using ID, and as I mentioned, also using health sites. At the same time, we also trained our team in Madare. So most of them were initially we used to use, most of the time in their previous work, we used to use GPS to do data collection. So most of them, those are the tools that they were familiar with. So through this project, we were able to train them on new data collection tools such as mobile apps. And we trained them on using maps.me to map new facilities and also to update the already existing data that is already there on OSM within their area. And another thing that happened, we also partnered with UN Habitat. So they had like an activity, like a study they were doing in informal settlements. So they were carrying out a part of the study was also doing some mapping where they wanted to just map out like all the facilities within these areas. And we got involved by mobilizing youths that we've worked with before, and those youths were involved in the data collection process, where they were able to map quite a number of features, ranging from the hand wash points that were set up, and health facilities, education facilities, wash facilities, And once exercise was done, so we went into an agreement with UN Habitat where they allowed us to do the data importation for them. So this was just basically to have like a proper coordination, because Kibera had also done some mapping in these areas. So we had an agreement that we will be doing importing the data for them. This will enable us to just track from the data that they have collected, what are some of the gaps that were there that are being filled by this data, and also to avoid any kind of duplication, just in case whatever they mapped, we had already mapped. And this, I would say, helped us to update over 1,400 points, both in Kibera and Madari. And later on, they shared with us more data for Kawangware, which is another informal settlement in Nairobi, and also they gave us data for Kisumu. For this, so for the two location, this has enabled us to at least put up new data on this those two locations, because they were not well mapped. So we are still in the process of importing the data and covering like two new grounds that we haven't worked in, especially Kawangware, which is an area that we've been has been proposed to us several times that we need also to start moving there. So with the data, it enables us to create like a base map of a proper base map of that area. So in future, if we get to move there, we at least have something that we can build up on.
Yeah, that's fantastic work, Zach. Really, really great. I'm very aware that we are running far over time. Is there anything else that you want to add, or are we happy to start breaking out into the community networking?
So maybe I just finish up. I'll wrap up with the last part, which is the partnership that we had with Give Direct, where we were able to provide them with a list of beneficiaries from Kibera that we've engaged with in previous activities and forums. And so Give Direct our program where they provide cash transfer to community members, and they were focusing mostly on informal settlements. So through the partnership, I can say there are over 500 residents, both youth and Kibera residents, that have benefited from the cash transfer. And this has really helped them in terms of just providing like basic support, because most of them have also been affected by this. So at least having like at least a monthly like you get like a cash flow at the end of the month. This has really helped them. And we've covered a story of a lady who used some of this support in terms of cash flow, and she was able to put up a business that has really helped her in a way that she's now having like a sustainable source of livelihood. So I would say that was also a big success for us, that some community members have been able to benefit indirectly through the partnership that we had with Give Direct. Thank you.
That's fantastic. Yeah, really, really great job. And sorry to cut you short there, Zach, but really fantastic. If anyone wants to get in touch with any of the speakers, then you can do so. But now we're going to move out into breakout rooms. So if you are able to spend the next 15 minutes with us to get to know some of the community members, that would be fantastic. Before we do that, just want to say a quick thank you to the H2H Network and to Cisco for supporting the COVID response. And yeah, you'll be automatically designated to a breakout room if you hang around with us for the next bit. So big thank you to all of our speakers. And yeah, Geoffrey, do you want to send us into our breakout rooms?